Hey, yeah, you're good to go.
Good?
Yeah, start when you're ready.
Can you remember a specific time where one of your clients was paying an unnecessary penalty for Medicare?
I remember working with a couple, and the husband had retired, and the wife wasn't 65 yet. She was still 63, I think, at the time. So they went on COBRA, and they stayed on COBRA for 18 months until she was 65. The problem was that he didn't do anything. He had 18 months of coverage on COBRA, which is incredible coverage in the eyes of Medicare. So what had happened was, when he went in for his Medicare enrollment on Part B, he had a lifetime penalty of the 2 years that he didn't sign up after retiring. So we see it a lot. We see it all the time, and COBRA is that one tricky thing, but a lot of times it can happen on the Part D drug plan as well.
What's a situation where you help someone avoid a really costly Medicare mistake at the last minute?
I always think back to this case I was working with a high income earner, and what had happened was their income from 2 years ago was giving them an income adjustment with Medicare, making the cost triple of what the standard premium is. And they had came through one of our webinars. They had already signed up for everything, but they had saw our webinar and they came in. By reviewing their status, I said, well, is your income the same as it was 2 years ago? They're like, no, I'm retired now. So they went into it thinking they were going to be paying triple the Medicare premium, which would have been the case. But what we did is we had sent them the appeal form. So what they did is they appealed that high income because they had that life-changing event of retiring, and they were able to reduce their cost by 1/3 of what it was going to cost them. So, sometimes that stuff happens. It's like you don't know what you don't know. So getting into information like that, it's can sometimes be a blessing for people.
I know there are some medications that can be very costly. Do you remember a time where a client had a medication that wasn't covered by their Medicare plan?
Yeah, actually, one near and dear to me is my uncle. He's been on Medicare now for several years, and thankfully he's fairly well off. But what had happened was when he was diagnosed with cancer, they prescribe oral chemotherapy pills now. So that is not, chemotherapy at the doctor's office, it's oral chemotherapy, so it's in the pill form. And a lot of those medications aren't covered by Medicare just because they're so expensive. For him, thankfully, he could afford the couple $1,000s a month that those medications cost. That's not the typical person, right? So that was a true moment for me to help educate the rest of the people that are out there on Medicare about these gaps that happen on the drug plan, because that's one of the areas where Medicare falls short, is on that medication side.
Are there any instances where someone's coverage has changed year to year, and why is that?
Yeah, it happens a lot, unfortunately. Just last year here in Rhode Island, Brown Health, a big hospital network here, stopped taking one of the carriers completely, middle of the year. So you had thousands and thousands of Medicare beneficiaries now that were going to a network of doctors that they could no longer go to and see. It wasn't gonna be covered by the plan. So we see that all the time on Medicare Advantage. So it's really important that when you're navigating this world of Medicare, that yearly you're reviewing your plans, making sure the doctors take them, because they can change every year, but they can also change during the middle of the year.
Have you ever had clients move to another state where that affected their Medicare coverage?
Yeah, so that happens a lot. Just as people are getting older, they retire in different states. So a couple things happen when people move. If they're on an Advantage plan, what happens is now we need to reshop all of the options that are in that new county for that client. So that can really change and shake up their health care. Now, if they're on a Medicare supplement plan, what can happen is they can, when they move, we'll have to reshop the drug plan for them, but the Medicare supplement plan will follow them. But what happens is it gets re-rated based on the state that they're in. So if they're in a lower med sup state in terms of premium and they move to a higher med sup state in terms of premium, it's kind of like revisiting their whole healthcare package again and making sure it's still affordable, still within budget, still meeting everything that they want it to meet. Vice versa, when it goes down, everybody loves that. So, but the same thing, we would still review their plan. It happens a lot. People move, and it's just a matter of hopping on a call again and just reviewing and making sure it's the best plan for them still.
Can you tell me about a client who thought they were fully covered on Medicare but wasn't, and found out the hard way?
Yeah, we see this a lot where people come to us after they turn 65 actually. And what happens is they think that they were signed up for Medicare by somebody. In reality, they're the only ones that can sign up for Medicare. We just help on the supplement and the Advantage side of things. So they came to us saying, oh yeah, I already have Medicare. We did a full review of their plan and they had nothing. No coverage at all. The good thing is though, we caught that within that 3-month window after they turned 65, so they could still enroll, still avoid any lifetime penalties for the Part B and the Part D, and get everything set up properly. Sometimes that's not always the case. We've also had folks come to us that have thought they had signed up. We figured out that they didn't and it's already past that window. Those people, it's super unfortunate because they're misled and they think that they're doing the right thing. They're being told that they're doing the right thing, but somebody drops the ball, unfortunately. And for us, unfortunately, we're the ones that kind of have to pick it up for them and help them out at that point.
Have you ever had to work with someone who had to switch doctors because of their plan, and what was that like for them?
Yes, I think of a couple of situations around Medicare Advantage. We've had clients in the past that, at the beginning of the year, we review their plan, has their doctor in the network. And then what had happened was, like March, April time, that doctor decided they weren't going to be taking that insurance anymore. So what happened was that person was stuck on that plan, and they can't change again until the next annual enrollment period, which is in October. So for that rest of that year, they had to change their doctor. And I remember them telling me that it was just a lot to just re-explain everything about their health history, their family's health history, all that stuff that goes with having a PCP to somebody else. And then once we got into the annual enrollment period, they were able to find a new plan that had the old doctor in the network. So it kind of went back to what it was supposed to be like. But yeah, for a year, they were, on their own looking for a new doctor that they had no relationship with. So it can be tough. We do see it a lot on the Medicare Advantage side.
Have you ever had a client that ignored your advice, and what ended up happening?
I mean, being an insurance agent, a lot of times we're making recommendations to people from our perspective and they just, might not want to take it for what it's worth. We've seen a lot of people, about 70% of our clientele carry what's called a cancer, heart attack, and stroke plan. So that means 30% don't, right? Some of them can't qualify, some of them don't see the value in it, but a lot of times what we see is that the numbers don't lie. And people that don't have a cancer, heart attack, and stroke plan, if they get cancer, they're calling us up, asking about what coverages they have. And 9 out of 10 times when that happens to someone who didn't take out a cancer, heart attack, and stroke plan, they say, I should have listened to you and take that plan out. Actually, it's funny. We had somebody more recently that had the cancer, heart attack, and stroke plan. He called in, he was thanking us about, talking through that product with him. And at the end of the call, he goes, my only regret is that I didn't buy more for the product. So it's kind of like a two-way street when you think about that.
Can you tell me about a time someone came to you after something went wrong, and what happened and how were you able to help them?
Yes, I feel like sometimes my role as a Medicare advisor comes to putting out a lot of fires that tend to happen. I remember a couple of instances, but one that really sticks out is we had a client that wasn't receiving Social Security yet, so they're paying into the Part B premium. They have to make a quarterly payment or monthly online to Social Security for Part B. And what had happened was they missed the payment. Their Part B got canceled, and now they're without coverage. They're freaking out that they don't have health care. And we were able to get on with Social Security. We were able to get everything backdated, get everything paid back up for them, so that way they had that coverage for that period of time that they thought they were going to be without it. So that's something that sticks out. But that's just like one of the things that we do as a Medicare shop here is like when things get overwhelming or when things don't go your way, it's good to have an advocate that's there that can hop on the phone with you, call Medicare, call Social Security, get everything aligned correctly.
Can you share a story where someone's health situation suddenly changed and their Medicare didn't keep up?
All the time. People that start on a Medicare Advantage plan, I have personal relatives that this has happened to where they start on Medicare Advantage because they're healthy. They think that they're never going to get ill, and what had happened is they were diagnosed with cancer. A couple people had to have multiple surgeries. Like I said, it happens all the time, and their health plan doesn't keep up because they're on a Medicare Advantage plan. So you have a out-of-pocket maximum of usually $8,000 a year that you got to meet before you don't have to pay anything else for the rest of the year. So in my eyes, that's a plan that's not suitable for that person anymore. They're paying more in premium and total cost than what they would have with the Medicare supplement plan. So we see it a lot. It's unfortunate. And that's why it's important when you're picking these plans of how you want it to work, that you're picking the plan when you start Medicare for how you want it to work for the life of being on Medicare.